Today I want to discuss one of my patients that had restorative motion surgery. This is an off-label FDA indication for artificial disc replacement. This is sort of an out-of-the-box operation, but I had a lady come see me from Texas years ago. She's 58 years old and she had had this surgery on the right. She had a fusion of 3 of her discs. The top one's the newest and 2 other ones. And the disc below, you can see it's narrowed and bone spurs. She wanted an artificial disc here because she was a golfer and she wanted to keep her head down and be able to move her head better. And she asked me, can you remove the fusion above and put in an artificial disc? And here's her film now. There are 2 artificial discs here below her fusion. So she went from 3 fused discs down to 2. We have a total of 5 discs. So I restored some motion. She actually can get her head down better now when she golfs, and she's enjoying her life much better in her 60s. Kind of fun, and we'll see more of that as artificial disc replacement surgery evolves with expanded indications.